Welcome back, guys. So we're still on week 2, and we are doing the pelvic girdle, the coxal bone. I like to remind you guys, just so you guys don't rip me apart in the comments, that I do not edit these. So if I mess up or fumble or my hand's all shaky, it will stay in here because I do not have time or the expertise to do that. All right, so coxal bone. During development, the coxal bone is actually 3 distinct bones, and then it fuses later on in development. So your first 3 terms with the asterisks, I can't say that word, next to them, the Ilium, Ischium, and Pubis, those are the regions, and your book will have a very good picture highlighting those in different colors so you can see exactly where it changes. You don't need to know exactly where it changes. It doesn't really matter, in this class at least. So the Ilium is going to be this large region up here. The Ischium, or Ischium, it depends on however you want to pronounce it, is this back portion. Oops, sorry, that's so loud. Is this back portion where my hand is covering. And then the pubis is this front portion right here where my hand is covering. Be careful to put pubis, not pubic. I know it's very tempting because it is in the pubic region, but it is pubis. All right. So now starting with the individual terms, the first one is the iliac crest. So that's going to be this guy right along here, right, this major portion right there. Then you have the anterior superior iliac spine, right, that's going to be this part. Then you have the anterior inferior iliac spine down here. Then you have the acetabulum, right, which is this giant socket, right? So the head of the femur sits here. For spelling purposes, I like to say acetabulum for spelling. It works out pretty well that way. Then you have the ischial tuberosity. Got to flip it back over. Ischial tuberosity. So that's the actual part that you sit on. This giant tuberosity here. It's really big. Then you have the spine of ischium, and that's going to be this guy right here. Then you have the greater sciatic notch right here, and then the lesser sciatic notch is right here. It is separated by the spine of ischium. Then you have the obturator foramen, this giant hole right here. I like that one. It sounds kind of like a transformer. Obturator. All right. Then you have the auricular surface. Auricular means ear-shaped. I don't see that here, but actually the picture in the book does kind of look like an ear, so I guess, I don't know. But this will articulate with your sacrum to form the sacroiliac joint. So that is our next term, and you can't actually see that joint unless I had an articulated pelvic girdle here with me, and I unfortunately don't. It is in a classroom that is being used right now, so I can't grab it. The next one is the pubic symphysis, which again would be better if I had a articulated set, but I don't. But it would go right here. All right, so if you're looking here, if you had another coxal bone, which, hold on, I think I do have another coxal bone. Oh, I do. Surprise, surprise. All right, so use your imagination. If you had a sacrum right here, these guys would come and articulate like that with a little piece of cartilage in between it, and that piece of cartilage in that whole fusion right there is the pubic symphysis. The next one is your pubic arch, which again, I got to put this kind of back tilt right here. This angle right here created by the 2 bones is the pubic arch. In men, it is much more narrow than in women. Women's are much broader. It's pretty obvious once you look in your book and just kind of get a feel for that, it's pretty obvious. All right, so that's going to be it for the coxal bones.